value-based care, again, it wasn't clear for the last 10 years, how do we achieve this outcomes-based care? This model has always been there, but now with more clarity, with more push from CMS, Centers of Medicare and Medicaid, and a clear pathway, I think more healthcare organizations will be achieving certain value-based care goals. So I think there's going to be a big growth in that segment, even on the health tech side, just in enabling value-based care.
Pavan, thank you so much for joining us. We'd love to maybe start with understanding a little bit about your background, how you got to where you are today at CUC and Beyond Podiatry, and learn a little bit more about you.
Thank you, Harshan. Yeah, a pleasure and an honor to be here. I'm Pavan, and I work with CUC and Beyond Podiatry as the Director of Strategy. So I did my med school in India. So healthcare has, always been there since the early days. And through my med school, again, with the direct patient care and also understanding the gaps in the system, I was able to identify where we could bring in improvements. So that was actually really interesting for me to understand these challenges, addressing these bottlenecks. And I wanted to take a step back from direct point of care and try addressing these. I did try, a few iterations here and there, with my mom's practice with the hospital that I was working in and studying. But I think my first brush with health tech and the transformation side happened with a large-scale project with the government of India. And while working on the tech transformation project for primary healthcare in India, I understood that, again, healthcare system in general is going to be working like a health tech or a tech company. And we got to be agile. We got to be, iterative. So that was really, really fascinating. And then I decided to take a step. I think that was my, point where I took the decision to move out of clinical care, direct clinical care, and work on healthcare transformation.
Yeah. And was that a difficult decision for you to say, hey, you studied medicine, but you're actually not going to practice and you're going to work more on the business side?
So business side, yes. I would say, it was a difficult decision. Mainly, I think, because I think the core component of healthcare was the gratification, the gratifying feeling of directly working with patients. But, as I got to work with more people and communities, so the impact that we could, drill down to the people and communities, I think that was fascinating and gratifying as well.
Yeah,
I do miss, working in clinical care at times, but I think I like shadowing the physicians once in a while.
Got it. So it's almost like you can have maybe a slightly larger impact with a lot of the work.
Correct.
That you're doing. And now you're at CUC. What is CUC's mission, right? I know that Beyond Podiatry is one of the ventures here in the States, but I know there's work being done abroad as well. What got you attracted to spending your segment of your work on CUC?
Yeah, sure. So I got introduced to the founder and CEO of CUC, Mr. Keita Hamaguchi-san, during my B school. So quickly, CUC stands for Change Until Change. And I think that was the first hook for me. So CUC is, again, a mission-driven organization. Our mission is creating hope through healthcare. And we are present in Japan, Indonesia, Vietnam, and in 2024, we entered the US market. So I wanted to work with a team that is very dynamic. Although it's a listed company in Japan, not almost, we do function like a startup, very much like a Teles and Kumyor. So we're always looking at what's the best next step for us. And we're quick with taking that decision. So that was very appealing for me, given that, healthcare is transforming so rapidly. Again, healthcare has been a laggard in this space in terms of tech transformation. But I think the AI enablement has pushed that forward. And I saw great scope of transformation of not just a single specialty care, but with CUC's model of having multi-specialty approach. Not in the US yet, but internationally we are in the multi-specialty model. So that was really appealing for me.
Yeah. As your role as director of strategy, I know we're working together on a large RCM, EMR, patient engagement, agent transformation, right? In terms of
Correct.
How Beyond works. I'm curious, what's your take and your approach, and how have you thought about making that switch?
Sure. So I think we, again, prior to even having these discussions with you all, so just like any other healthcare providing network or a health system, we had our list of challenges. So we looked at these list of challenges and then divided into broad themes. But just like any other health system or a large network, I think consistently the largest theme or the priority theme would be revenue cycle management and business operations. So we identified that that's a significant bottleneck that we want to solve, so along the lines we had multiple buckets or themes. So we were trying to work on these in multiple fronts, and we realized that again, we're looking at multiple piecemeal solutions for each of these. Again, one of the areas that we wanted to focus on is reducing the vendor spread, consolidating the efforts, bringing in more efficiency, not just on the cost side, but in terms of the operational workflows for the business operations teams, physicians, patient experience as well. So that led us to Athilas and Kamyor, because again, all of the bottlenecks that we had, you guys had the solutions that ticked off all of the options. So yeah, it's been a great journey so far. Our team is really happy with the revenue cycle management operations, and we look forward to transforming our entire care operating system with Athilas and Kamyor.
That's exciting, and we couldn't ask for a better partner. And I know that's why we're spending time here as we think about further development together. I'm curious in your role, and doesn't have to be specifically about us. How do you think about balancing short-term versus long-term needs? I'm sure you make that trade-off all the time.
Sure, yeah. Especially when we have to be fiscally responsible.
That's right.
And again, we have to convince the leadership. We have to convince the physicians on making the switch. So balancing the short term and long term, I think, was easier for us than with other organizations in healthcare providing space. The reason is we started out with a vision. So we have that vision where we want to achieve, and we're backcasting on what we have to do. So all of that comes down to sorting out our core operating system. So I think that was fairly, easier for us in getting to this phase.
When you make, and I'm sure you have lots of partnerships that you can explore. You have a lot of segments that you can go into, new verticals that you can focus on, whether it's in the US or overseas. What's your mental model that you have of which ones to say yes to, which ones to say, hey, this is interesting, but we're going to look at it in 6 months or 12 months?
Right. So I think closely aligning with our short-term goals and our long-term vision, that's been the key. And as I mentioned, there are multiple solutions, multiple partners, but again, with our focus on achieving the long-term vision, we would want to limit our vendor spread and our partner spread as well. So I think that's been driving our decision making with the right partners.
Nice. That's helpful. When you think about implementing new technology or a new project, I'm curious, there's this aspect of change management to it, right? And I'm sure you've seen this across all your segments, right? And there's always going to be some change management. How do you align people with processes and systems?
So, when I have these discussions with the physicians and all the non-clinical teams as well, so we like to remind everyone that CUC stands for change until change. So we're always changing. We stop at nothing. So I think, change management is, I think, the most important bit, at least on the provider side, the provider network side. And one of the ways we've been able to address this and handle pushback or get some wins is by aligning with physicians, aligning with the key stakeholders within the organization, right from decision making, and then having them interact with your team. I think that's brought a significant buy-in from physicians and also the non-clinical teams. So that's been great. And also aligning on the vision. So I think, where most of the organizations dealing with this kind of transformation can benefit from communication is on the vision. So communicating what we want to do in the short term, what we want to do in the long term. So we actually had a pain and pleasure matrix that we shared. So there is going to be, again, we don't want to sugarcoat everything.
Sure.
Change is hard. And there is going to be, there might be some hiccups along the way, but we wanted the team to be prepared for that. So we shared some of the short-term pains that we may face, but the long-term gains that we're going to achieve together.
Yeah.
So that was key for us, alignment and active change management.
And sometimes in a lot of the conversations we have, the physicians can be very busy, right? I mean, they are trying to catch up on notes. They have 40, 50 patients sometimes they'll see a day if it's especially high throughput.
And they have a personal life as well.
And the whole goal is to give them their personal life back, right?
Absolutely.
It's interesting like how you think about balancing that with, your goal is to change and adopt the new technology, but can imagine sometimes those things can be at odds, right? When you think about where do you want to spend your energy, where does a physician want to go and spend their energy as well?
Yeah.
And then when you think about adopting new technology, when do you think about the right time to go do it? Because if it's your busy season, for example, you probably don't want to, right?
So in terms of overall, I think it depends on the appetite of the organization. Risk appetite as well.
Yeah.
So I think we're glad we have a team that's dynamic and we're early adopters. So that way we are able to scope out solutions and then bring them on board with our current scale in the US market. So that's helping a lot.
How do you know the right time to do it, right? Because sometimes in the year it could be busy. Sometimes you have other focuses, but you obviously want to continue to innovate without burning people out, right? I'm curious how you think about the right time.
Yeah. So we thought about this diligently, and then we spread this across. That's the reason we want to actually go live with the major transformation during our slow phase.
Mm-hmm.
Typically, I think it's seasonal for all of the healthcare groups, and the start of the year with the insurance reset. That's when I think we can bring in majority of the changes.
Yeah.
But we did not want to delay our prep, and all through. That's why we've been scoping and co-developing with the physicians, and including the training plan. We want to start all of that beforehand and then be ready for that transformation.
Yeah. I also think what's interesting in the beginning of the year is when you think about the suite of tools for patients to just understand their balances better, to understand their insurance better, to understand what they have to pay out of pocket versus not. There's this entire suite of patient tooling that makes their care journey that much easier as well. And so it's an interesting time to do it at the beginning of the year when you reset deductibles and you take on a big change like that. And then what I'm curious about is whether it's podiatry, you can pick any other specialty. What are some of the major innovations that you're seeing coming down the road that you guys are really excited to innovate or to invest in? Excuse me.
Yeah. Not just podiatry. I think most of the specialties and healthcare in general in the US. I think 3 big keywords in the healthcare industry: value-based care, precision medicine, and consumer health. So along these lines, we've been looking at approaches, on the technologies that can support us, on the business segments that will support our growth. So value-based care, again, it wasn't clear for the last 10 years, how do we achieve this outcomes-based care? This model has always been there, but now with more clarity, with more push from CMS, Centers of Medicare and Medicaid, and a clear pathway, I think more healthcare organizations will be achieving certain value-based care goals. So I think there's going to be a big growth in that segment, even on the health tech side, just in enabling value-based care. So right now, again, this better in terms of metrics, but I think majority of the data is unstructured, and querying that data is so difficult. And for us on the healthcare side, we do not have ready access to those tools to query the data to support our case in pitching for better contracts with the payers.
Yeah.
So I think there's going to be a tremendous scope there in developing or enabling value-based care. And on consumer health, I think not just on the policy front, but there is now an active shift in place of care. From earlier it was hospital to ambulatory centers, and now it's ambulatory centers to further pushing the care at home. So there's a lot of focus on shifting the care at home and enabling the patient or the consumer to take decision. So there's going to be huge scope on working on that front. So along the lines of our specialties as well, we want to support the decision making for our patients and consumers and physicians. So we've been, thinking about how do we approach all of these three segments.
Makes sense. And I like that you have the very clear vision of where you think the technology is coming. I'm curious on the value-based side, because you operate in international markets, is what you're seeing in the American market ahead, behind, in parity with some of the other markets that you're seeing?
So I think the payer model is very different, across all of the markets.
Yeah.
But largely, if you look at it, it's fee-for-service model.
In all the markets you're looking at?
All the markets. Fee-for-service is what is dominant at this time. I think US has been forefront in looking at the outcomes-based aspect. Although it's really challenging for small to mid-segment healthcare providers. But I think, there's going to be more active shift towards the outcomes-based care.
Got it. And then on the consumer health side, are there any tools or investments you're making that you're really excited about? And again, I'm not as familiar with the universe, but are there things that get you really excited?
So while I cannot comment on our specific pipeline, but we're generally interested in the remote patient monitoring space. Again, this all dials in with value-based care, with consumer health, giving patients the power to take care of themselves at their homes. So we've been looking at remote patient monitoring, not just for podiatry, but then, how do we impact patients' lives overall? So I think there's going to be a huge uptick in the remote patient monitoring space, and I'm sure you all know this, and you've been working on the remote patient monitoring space. And something interesting that recently was announced is that the challenge with remote patient monitoring was the policy front, with CMS dictating rules on the reimbursements for the remote patient monitoring. I think with that easing and that being more favorable for delivering better care 2026 onwards, there's opportunity for
the audience that may not be as familiar. What was the policy change that?
Sure. So CMS earlier dictated minimum, I believe, 16 days of measurements, metric measurements, physiological metric measurements, and now they have a range between 2 to 15 that they've announced. So for solutions that need not have that comprehensive 16-day measurement, I think this will be helpful, because if the reimbursements do flow, then there's going to be more adoption of these technologies by providers, healthcare groups, and better outcomes for the patient.
Yeah, one thing that we talk about internally is, I think it's one thing to provide great care, and I know you guys do provide great care, but if you can't get reimbursed for the services that you're trying to provide, it makes it very tough to go and provide those services, right?
Exactly. Yeah.
Unfortunately, there's an adverse party that makes it tough to get reimbursed as well. And so, I think for us, when we heard about that regulation that came out, it's just fantastic to hear. We've been in RPM for a long time. And so very apt that you brought that up. I'm curious, are there any other technologies, or as you think about the future of outpatient care or podiatry or just general any care, I know you guys are not just focused on podiatry, that you're really looking forward to? So maybe it's not there yet, but ones that are going to impact the industry in a positive way. I'm curious your take there. So
maybe along the lines of the musculoskeletal care itself, because we've been looking at this. So patient-reported outcomes is going to be critical for value-based care. And then, how are they going to report this? This is on consumer health platforms. So I think there's going to be better management of this whole process. Again, this space has many piecemeal solutions, consumer health space, but with better management and integration, and then just having that interoperability and maybe communicating systems.
Yeah.
I think that it's going to ease the workflow on that front. And with more uptick in utilization there, I think, it's going to support all of the adjacent industries.
And what about, one thing we haven't spoken about yet are AI-based use cases, or we've spoken a little bit more about the automation side, or in this case, RPM is sensors. I'm curious, what are you excited about on the AI side? And are there things that you guys are deploying right now or you're excited to deploy?
Oh, yes. So we are excited about the agents that we're going to deploy. So one is on the clinical front itself. The physicians are excited, when they hear they're going to have agents working for them, pulling in all the data, not just from the patient charts, but also from clinical evidence sources. So that's something that they're excited about. But also, when we discussed about patient follow-ups, I think agentic AI is going to be game changing in that regard. Just being able to connect with multiple patients at once and then pulling in all of that and then inputting that data onto the chart.
Yeah.
That's going to be phenomenal.
Yeah. Yeah. And what is, if you have a story or two of the most incredible, whether it's agentic or AI use cases that you've seen, like you've actually seen them live or working, are there any that come to your mind there?
So we had a discussion. So, earlier phases of the demo, when we had the call center side demo with you all, it was so good. We couldn't believe it's an agentic AI solution. So again, we were just discussing, maybe we should have a disclaimer that you're not speaking to an actual human.
Yeah.
You're speaking to an agentic AI solution.
Yeah.
So that was.
So on that solution, because, and I agree with you, right? And I think when you put it into production, you usually do have like a disclaimer. Do you think that as you guys deployed, and I have my own thoughts here, but in your guys' patient population, do you think that, it can take 80, 90, 95% of calls, especially on the older population, versus having to wait for someone to get on the phone or wait for the time to actually have someone get on the phone during business hours? Do you think you can do that first pass?
Yeah, we're optimistic about it because again, what we don't like is press 1 for this, press 2 for that.
Yeah.
So given that this is very conversational, yes, I think, it's going to be game changing. And even within our demographic, older individuals who seek care, I think it's going to be supportive.
Yeah. We think so as well, clearly, but I was curious in your demographic what some of the early signs and signals that you guys are seeing. And then maybe the inverse of that is, where do you think things go wrong, right? Where are there types of AI that you deploy that you're like, hey, maybe we're not ready for this quite yet, and this is where we would have to get to for us to be ready? I can think of a couple ideas. I'm curious if you guys have had those discussions internally.
Yeah, we've had discussions. Again, it's something we have to be careful about in terms of the healthcare data itself. So AI generally, initially at least, not this year, but then, when we started scoping these solutions, 2024, it was a difficult discussion because again, the industry was not, I would say, from your perspective, maybe mature, but from healthcare provider space, sure. Yeah, it seemed like the model was not mature yet. So some difficult conversations then, but with those easy small wins and gains, I think we've been, able to move forward from there. And also the tech is very different from last year. And if it's changing so rapidly, I'm just it's so fascinating. I'm looking forward to the future.
Yeah, absolutely. Yeah, it's interesting because healthcare, I think you mentioned earlier, generally does move a little bit slower sometimes, right? Yet you think about the ambient scribing space, and there's a lot of players out there. It seems like most people are open to implementing and have implemented and have integrated solutions pretty quickly after language models became available, right? Especially for generally the adoption can be a little bit slower. I think the adoption here has been really quick.
That was surprising. So on your previous question on, did we see any failures with AI? Again, I think we were one of the earliest adopters in the ambient AI scribe. So, we've piloted three different tools. So
not to be named.
But here we are for a clear reason. So if it was just beyond one piecemeal solution, we wanted to solve the whole pie.
For other folks that want to make big changes, right?
Yeah.
What does work well for you in your learnings?
Yeah. So the pilots were extremely helpful. Trying it out, understanding what fits our needs. That was great. And that way we were able to implement small solutions, small scale, get the buy-in with the physicians, with the organization. So I would say I would recommend healthcare organizations to try these pilots, small scale pilots within their groups, focus groups.
And when you talk about piloting, because that's something that, we're familiar with and we know how to pilot, what is the indication of any technology, right? What is the indication of the hallmark that, this pilot is successful, we want to invest in it? Who are you talking to? Right. How do you get that great? Just help us understand that.
Sure. Yeah, I think a continuous feedback mechanism all through this. We'll have to think about different lenses here with the pilot as well. Primarily the physician and the patient. So that's where we want to bring and solve the problems, bring improvements and solve the problems. So continuously working on understanding feedback from patients, physicians, and also on the corporate side. So just aligning all of those goals, and then if it fits, definitely, I think it's a win and a go.
Yeah, that makes sense. And then as you think about, because the second point you mentioned was the cost pressure, and thinking about the cost pressure and the idea that healthcare is heavily inflationary, and it is. I think we have a chart in the office somewhere which shows the price of healthcare has gone up faster than any other subsegment.
Correct.
In the last like 20 or 30 years. Yeah. So there is absolutely margin pressure, right? And I'm sure you guys see it. Medicare will cut rates. You'll see that. How have you thought about rationalizing, assume Medicare is going to cut rates X amount every year, or maybe they may go flat. How do you make those decisions, right? Because year over year, there is going to continue to be pressure. The price of healthcare is going to continue to go up. We hope to help solve some of that. But I'm curious how you think about your functionally, your P&L as a business with all these factors into place.
Yeah. So the margin pressure is immense. I rightly said, and just I think in May, they announced again a further reduction in the fee schedule, 2.7% across the board. So that's significant. And then also the inflationary pressure is there. If you look at it, probably the lines would meet at some point. That's right. If you're not going to bring in any changes. We're not in the space where we can turn on the revenue like this with D2C. So the improvements that we can bring in is with the current operations, optimizing the current operations, working on the cost side, while supporting the growth and the revenue side. So we've been addressing that, and there is again a concern that AI is going to replace humans. So I would say AI is going to support humans, and I want to quote Jensen because I just love that AI is not going to replace humans. It's the humans who use AI that are going to replace the other humans. So we've been supporting our teams, enabling our teams with all of these tools to again optimize our current workflows and support the future growth. So I think healthcare organizations have to look at it from this perspective, and also the communication I think would be key to the teams on what we want to achieve with this.
Yeah, I love you said that, because I think you're 100% right. How do you get people on your team that historically haven't used different language models or don't have that background or don't have the experience, all of a sudden are managing an army of agents, right? And they're configuring and they're updating pathways and they're making it so it's usable to you guys, right? Like, how do you go about implementing that paradigm shift? Because clearly you believe it, but you got to get your team to believe that as well, right?
Yeah. So I think what we've been doing is, aside from enabling with tools, we've been supporting on the training front. So I think that's going to be key moving forward, maybe from the healthcare provider space, but also, from the health tech industry itself, having these trainings for the respective niche verticals.
Got it. Helpful. Last question I have for you is, if you think about the next 30 years from now till 2050, what do you have maybe one or two bold predictions of where you think healthcare is going, or things that you'd like to see happen?
I would say, with precision medicine, maybe complete personalized treatments, and maybe embedded systems in the human body that can, detect these chemical changes, address them autonomously, take decisions locally. At each individual level. I mean, this is something I don't know, way ahead in the future. Sure. I would like to see that, but I think there's going to be smaller steps before that, definitely. With your remote patient monitoring solution, I think if such models can be taken everywhere, if it's made available to each of the patients or consumers, I think diagnosis is going to, tremendously change. Early diagnosis, early detection is tremendously going to change healthcare. So I would say I would like to see solutions on the
Yeah.
early diagnosis and screening and early detection phase.
And I mean, that's where the models are just getting so good. I think we all know this is just the start, right? The model that was released last year is now obsolete because there's a new model,
Yep.
right? Just imagine how that compounds over the next many years. I would tend to agree with you. So looking forward to that as well. But Pavan, thanks so much for the time. We appreciate it.
Thank you so much.
Awesome.
This was wonderful.
Awesome. Thanks.